The finishing in orthodontics topic is it's not only one lecture, it's a group of lectures. So because of the time, of course, we only stress upon the 3D problems, or what we call it, the 3D order or 3-order bends. I preferably call them 3-order problems. So because when you have a problem, you can either do many things. One of them is bending the wire. So that's why we usually call them 3-order bends, but actually these are 3-order problems. I have many other lectures talking about, of course, the direct and indirect bonding, and a lot of stuff regarding the bracket prescription, the ABO guidelines, elastics. All of these have separate lectures. But today we're gonna stress upon the 3-order problems. And also this presentation is updated. So you will see some special videos and pictures done for you today for this presentation. So as we all know that the orthodontic phase of treatment consists of 3 phases: leveling alignment, space closure, and finishing. So I always tell my students, whenever you have spaces and your teeth are not aligned and they are not level, they're still, you have rotations and you have deep bites and open bites, you are still not allowed to go for the finishing stage. So this is important to know when to go and start the finishing stage. You have to finish all the 2 other phases in a proper way. Otherwise, your finishing stage will be problematic. Of course, I'm fond of wire bending, as you will see in this lecture. And this is one of my students' names. I bent her name on the wire to just make her more enthusiastic for wire bending and to be fond of orthodontics. So we'll share some concepts before beginning the lecture. As I've told you before, I'm incognito certified. I've already taken more than 2 or 3 lingual orthodontics courses, and also I'm certified Invisalign. However, and I also love to use the self-ligating brackets. But however, when it comes to the conventional brackets, I have some concepts. So the most important of these is that I encourage myself and my students and all my colleagues to use the steel ligatures instead of the elastomeric ties, because the steel ligatures keeps the wire inside the bracket and fills in the slot. And even these are one of my incognito cases. I can usually use an elastomeric tie, but I still prefer to use the steel ligatures even in the lingual orthodontics. Why? Because the seating force is more and more favorable using the steel ligature than the elastomeric tie. Also, we have periodontal and hygienic problems, whereby higher scores goes for the elastomeric ties for the plaque index and the bleeding. So in comparison to the steel ligatures. Also, we all know that the elastomerics, the force degrades within the first 24 hours, and then goes downwards, and then reach to a 0. That's why you take much time during the 3 phases of orthodontics, especially the leveling and alignment phase, because you're still using elastomeric ties. For the frictional forces, there are the review or the literature is a little bit scarce about this point. However, can be. In 2005, he stated that the steel ligatures have lowest frictional forces in compared to elastomeric ties. Even Iwasaki stated that even if you ligated the steel ligatures firmly or loosely, it doesn't matter. You will have the same result at the end. Some of my colleagues, they are worried about that these stainless steel ligatures, it will take much time to perform. However, you can see in this video, when everything is prepared, you can do everything fastly and neatly, especially when you are having a four-handed dentistry and you have assistants beside you. So it's not a problem. I think it takes a little bit more time than using the elastomeric ties, a little bit more time. Maybe I take 3 minutes per arch to do full ligation. And I encourage also the clinicians to use the condenser and not the tucker to tuck in the ends of the stainless steel ligatures. Also, some of the clinicians also they get worried about the chairside time needed to remove the steel ligatures. So this is my technique. I will show it to you, and there is a sound so that you can hear the click of the cutter. You can see, and of course, doing that without injuring the main arch wire, you have to use loops. I encourage also orthodontists to use 2.5x loop as mine, at least. I think 2.5x is enough for us as orthodontists so that you can see all of the arch in one view. More than this, it will be heavy and you will see 2 or 3 teeth only in the same view. So using sharp cutters and then with a probe, you can slip it out easily in no time. So don't worry about changing the wires, the steel ligated wires. Okay. One of my main concepts too is that I measure the forces. So I have in my clinic the Corex Dentarum force gauge. It's very, very nice. Much companies now have amazing also these force gauges. It's available from different companies. However, I believe that you cannot start your career in orthodontics without having this one type of the force gauges inside your clinic to understand what's happening. My fourth concept is that I encourage also clinicians to use the double tubes, especially if you can have them with a convertible one in the main arch wire so that you can anytime remove the sheath to align easily the second molar. However, I usually encourage all my students to use the double tubes in all their cases. It opens a versatile techniques and styles to do your job. So I think I feel like handicapped if I use a single tubes. And this is one of like the cap, what we call them, the cap removing plier, so that you can easily remove the cap from the tube, and then and you can grab it with a wine guard to remove the rest of the cap, and then you are done, and you're having now a convertible tube. It's like a big bracket on your first molar. You can see, of course, I have no problem at all in my bonding strength, so I rarely use bands unless I must use an Hyrex, for example, or a Bulgarian bar. Also, it happened that I ligated one of the centrals first, and I had a look on the wire from the top view and see how the teeth during leveling and alignment, because it's like a two-couple system in all these brackets, so you can see how it affects the neighboring teeth. So this is important to understand. That's why the colleagues and experts in the segmental technique love the segmental ones, because they don't like these undesirable effects on the adjacent teeth. So what about the wires? The wires for the finishing, will we use the TMA stainless steel or the nickel titanium wires? Of course, the best selection is the TMA. The TMA has nearly half the modulus of elasticity of the stainless steel, and it delivers lower force than the stainless steel over a long range of time. And this is the most important thing. If you want to substitute the TMAs with the stainless steels using, for example, a 16 by 22 steel wires and making a lot of helices just to drop down your forces. However, you forgot a very important point about the biomechanical principle in the TMA wires, the titanium molybdenum alloy wires, because you lost the long-term effect of the wire. The stainless steel will deliver, even if it delivers the lower force, it will be delivered in a very short term, maybe in 1 or 2 weeks. However, the TMA wires will continue to be active for 6 weeks at least. That's why I encourage you in the finishing stage to go for the TMA wires. The TMA wires is offered now by different companies. You can see the Aramco ones. They offered them, and they were the first to produce them in the market in the 1979 by Charles Burstone. And then you can have it also with the CNA Beta 3 nickel-free arch wires from Orthodontics. Also, Forestadent have produced very nice work in conjunction with Professor Nanda. They call it Nanda wires. They use them a lot as cantilevers for deep bite and open bite correction. So they are very nice. So another thing is that it's very important to understand that the wire stiffness of the 16 stainless steel wire, for example, is similar to the 18 by 25 nickel titanium. That's why I sometimes replace maybe the 16 steel wires, maybe one of the wires I use in the finishing stage, if there is something with my stock with the TMA wires. Also, for the 19 by 25 stainless steel wires, they are 3 times more stiff than the 19 by 25 TMA wires. So I really care about my forces to keep them to the minimal. I don't want to hurt my patients. I don't want to initiate root resorption. That's the point. For the first order bends, it's like an in and out bends and rotations, and for the canines and the molars. And for the molars, we call them the molar out bend and toe in. For the step, for the first order bends, we can also do the derotation bends. You can do it with a proper bracket bonding, or we're doing them with this derotation bend and wire, as you will see later in the cases. And this is the second order bend to upright the roots, so that's why we call them second order bends to solve second order problems. And the third order problem, which is the torque, either labial or palatal root torque. So let's start. For the first order bend, the most important item to take care about, and I received much messages to clarify this point in this lecture, and I did that. I did these videos with the help of my staff to show you what, just to make everything clear. For customization of arch form, you have to, that all different companies have different arch forms. So you have to pick them up from different companies and check what is the most that suits better your patients, and especially for each patient. So usually I have different arch forms in my clinic to see the most match I can have. For example, I have the Dentaurum ones, the orthogonizers, Oromco arch forms, and so on. You can see here that this is you can see that's a very wide arch form for this particular patient. So I will not deselect this arch form. Also, this one is a little bit near to the fit, but it's not fit actually. For the broad arch form in the Damon catalog, it's it's one of the nearest ones, one of the best match, the broad arch form for this patient, of course. Why you have to select your arch form? Because using nickel titanium wires during alignment, leveling and alignment, you must be near to home, okay? You can see, for example, the Orthos arch forms from Oromco ones, they are very, very wide. So actually, and this is the lower mandible, so that's why I don't like to expand the lower arch form. I want to preserve actually the lower arch form to preserve the intercanine width. So these are the templates for 3M ones. You can see the ovoid ones are the closest match for the mandibular arch form. And this is the square ones. It's clear that it's very wide. So this is what you have to do in the beginning. Otherwise, you go to plan B. What is plan B? You will Xerox the casts of the patient. So I made a video to see what I'm doing. I cut a small piece in the white paper to fit in the models. Put the white paper on the screen of the Xerox to copy it, to scan it and copy it for you. And yeah, then close, okay, close it and then start scanning. So now you will have the patient cast copied or scanned on a piece of paper. It makes your life easier. There is no need to bring the models each time to the clinic. You can save this piece of paper in the patient's file if you're doing, of course, if we are all of us, we are doing filing system. So you can place this piece of paper inside the file. And I guarantee you it's nearly one-to-one. If you want to count the amount of crowding, for example, you can do the amount of the arch form discrepancy and so on. But we see today, we'll watch today together the arch form selection. Then you take this Xeroxed models and go for the wires. Pick the nickel titanium wires. First, check the adaptation of the nickel titanium wires you have. And this is very, very important. You can see here, this is the on-shelf nickel titanium wire, which is I grabbed from the packet ready. I didn't customize any because we all know that we cannot customize nickel titanium wires, right? No, the answer is wrong. You can customize the nickel titanium wires. It's coming now. However, what I want to say is that you are changing the arch form of the patient without noticing it. And this is very dangerous. If you intend to change your arch form, well and good. But if you are one of the schools that you are preserving the arch form, so take care. This is the red alert for you. You can see how the nickel titanium ready-made wire is not fitting at all to the arch form of the patient. We want to fit, of course, from the buccal part of the tooth. We want this as a guide because the brackets, of course, are bonded to the labial surface. So these are the guides for us. So this is the nickel titanium wire, still wide. What I will do is I will start Reforming the nickel titanium wire. Yes. This is a nickel titanium wire. I will start reforming it, changing the arch form of the nickel titanium wire. It's very easy. And I got this, this skill from the lingual orthodontics doctors who taught me my certification courses. Because the lingual arch form, you know, it's much narrower than the labial arch form. So you have to do something. So it's not difficult. Also, it's not difficult to do this with wearing gloves for infection control. This is very nice. So now from the canine or the first premolar to first premolar is okay. And then I grab the wire and start straightening up the rest of the wire to cope with the arch form of the patient. Okay. And then straighten up the rest like this. It's easy. Okay. And don't worry, these are from nickel titanium wires from one of the best companies in the market. So it's not because of the manufacturing process is not okay. These are the nickel titanium wires we always have in our stock. Maybe you didn't try it before. And now we have a good matching to the patient's arch form. Of course, you don't have to be so accurate in that, but what I'm telling you from the beginning, we have to be near to home. Let's compare it with the custom one. This is the one I did now. Let's compare them together with the ready-made ones. Is there a difference? And you will notice now. You will notice the very big difference between both arch forms. Let's put them on the template. This is the ready-made one. And this is the customized one. You can see the difference. What I'm trying to say is that as orthodontists, don't make anything but goes by chance in your practice. If you want to expand, okay. If you don't want to expand, you have to be in full control. Also, you have to check after this customization the plane of the wire. It's also very easy. I close one eye, as you can see, and then the right and left sides should match together. In this situation, after the customization, they are not matching. I will try to make them in one plane. Okay. Don't forget, I'm playing with a nickel titanium wire now. All this video is nickel titanium wire. And now you can see one plane. This is how I check my planes. I don't place them on a table. I just close one eye because it saves time and it's more accurate. Now it's one plane. So another tip, maybe it's away from the finishing lecture, but I did it for you too. You can do your reverse curve wires in the nickel titanium. It's very easy. There is no need to buy the ready-made reverse curve wires. Just do the bend, but I usually don't use them much because they procline the lower incisors a lot. So but I just thought it will be helpful if you are enthusiastic using the reverse curve wires. My advice is that to keep the bowing of the wire to minimum to minimize the side effects that you can have using the reverse curve nickel titanium wires. And also always check please the plane of the wire. The teeth will follow the plane of the wire. It's very smart to keep away from problems during the first and second stage of treatment to minimize the amount or the time of finishing the stage at the end. I'm checking the plane, checking the bowing, the amount of bowing in the wire. Don't increase more than 3 millimeters from the floor, from the table, okay? Don't make it so steep. And then I check the plane like this. Close one eye. If they match together, both wires are on the same plane, so you're done. Okay. So what about the stainless steel wires? The stainless steel wires is used, of course, after leveling and alignment. So it's very nice that if you will take the first way to provide or to know the arch form of the patient. So you already selected the best fit arch form from the templates already in the catalogs of different companies. So if you go for this way, so you know already that your patient, for example, has an ovoid, or the best match for your patient is the ovoid shape for the 3M, for example. So usually we select or we customize the lower arch wire, and then the upper arch wire comes 2 to 3 millimeters wider than the lower. And this is what we call it coordinated arch wires. So when on the transferring from the nickel titanium to the stainless steel wires, you have to take care about, you have to be very meticulous in customizing your arch form, because the stainless steel, the teeth will obey exactly the shape of the stainless steel. So here is how I do the adaptation of the round steel wires. Usually the round steel wires, they are not stiff, so most of the adaptation I will do it with my hands. I want you to recognize this coming. This is how I see what I do. See how I grab it between the fingers and I open it from the middle like this to confirm with the intercanine width. See? Very easy. And then you're nearly done. You can only expand the sides, the right and left sides, also your hands, okay, to confirm with the selected arch form. You can notice easily that if you have a small arch, you can easily adapt it to be larger, but it is difficult to have a larger arch form and to adapt it to a smaller dimension. So take care. That's why maybe in my stock I order lower arch wires only. For the stainless steel ones, I order lower arch wires only. Why? Because I can easily hold them like this, as I mentioned, as I have seen in the video. Just expand it with my fingers, and I'm done. You have the upper one. But the other way around is more difficult, because narrowing a wide upper arch to fit the lower arch, it will take much more time. You can do it, of course, but it will take much more time. Anyway, the on-shelf wires, I have no respect for them. Every wire, I grab it from my shelf. It should pass to the template, and I always tell my students that one day one of the templates that I mostly use was not there for a reason. I was nearly to cancel my appointments that day, because this is not only an arch template, it's also a symmetric chart. I print it on a graph. You can see the graph, the small cubes. So you can see the symmetry of the arches, the right and left sides. So that's why it's very important. When we want to manipulate with the stainless steel wires, please do all the bend and hold from the ends of the wire. Don't touch the middle part of the wire. Otherwise, you will have kinking and you will have bending, and you won't have a smooth anterior curve. So please grab it from the ends like this. And of course, there is no smoother than your thumb and the index finger, so that you ensure that there is no kinking or bending in the wire. Usually take care to conform or adapt from the canine to the canine, and the rest is easy. Take your marks and then expand distal to the canines. It's very easy to do it. Just concentrate on the front or the canine to canine arch form, and then everything is easy. Of course, after doing it, I will check that they are on one plane. However, for the rectangular stainless steel wires, it's a little bit difficult. Usually, I can't use my own hands to adapt them, so I use two important pliers, the Tweed ribbon arch plier or the Della Rosa plier, or what we call it the hollow chop plier. It's the same. The Tweed or the ribbon arch plier is flat, so that you can grab the rectangular stainless steel wire without rotation. If you bend the rectangular wires and you develop some rotation, you will change the torque. Maybe you don't want to change this torque, so the wire should be plain in the first, and then you place whatever torque you want. So in the customization, I use the Tweed pliers. Customize first the front, and then it is easy distal to the canines to go in and out. Whenever you grab it with the plier, see how I'm holding the tip of the end of the wire with the fingers away from the peaks of the plier. Otherwise, you will have kinking and bending in the wire. Of course, the tooth will translate this as an intended bend, and it will do the bend. Believe me, the tooth will follow. So that's why you have to take care, especially, of course, with the stainless steel, and in particular, the rectangular ones. Also, you can use the hollow, of course, we'll go, sorry. Also, you can use the Della Rosa or the hollow chop plier with groove or without groove, it doesn't matter. However, I like more without grooves, because with grooves it's not allowed to enter the wire unless in the groove. Otherwise, it will make some distortion in the wire. So I have to take care that the wire is inside the slot in the groove in your Della Rosa plier. The Della Rosa will help you to do the anterior curve, okay, from the canine to the canine. And then the Tweed plier will help you to adjust the area distal to the canine tooth. Also, you can use the Della Rosa to contour the sides of the wire. I like it also. When selecting your hollow chop plier or Della Rosa plier, you have to confirm that is one of the big companies. This is the first thing. The second thing, that the corners are rounded. The corner here is rounded, completely rounded. Otherwise, you will have bends. Especially, this advice is very precious, especially for beginners. So don't buy the cheap ones, because the cheap ones have very sharp ends at the point here. These ones are very narrow, so that if you push the plier a little bit more further, so you will not have any kinking or bending in the wire. And then this is the plan A. Plan B, if you go customization without using these templates, so you will wait. You will do what I did before for the nickel titanium wires. And then on transforming to the stainless steel, you will have to have this wax, bite to wax. The patient should bite on it, so that the incisal edges and the brackets are clear on the wax. And then you start doing the adaptation. After you've done the leveling and alignment, you have it, the arch form is a little bit easy for you to follow. But of course, you did leveling and alignment with customized nickel titanium wires, or the nickel titanium wires that are very close to home, very close to the patient's arch form. And these are the rectangular steel wires, or TMA wires, by the way. You have to also shape them. You can hardly find the best a company that fits the patient's arch form. Take your time to do the adaptation. Why? Because this wire, after you've done, and this is the, and then it returns to the arch form template to check the symmetry. I will do a very nice trick. I will tell you a very nice trick. I will go and Xerox this wire before placing it inside the patient's mouth. And I am always concerned with the lower arch wire. Okay, so put the wire on the screen, cover it with a white paper, close the door, and scan it. And you will have a very nice surprise now that the arch that you have took much time to adapt and everything, and here is the patient's individualized arch form. You will continue with this arch form till the end. And this is the lower arch wire. Of course, it's very, very easy to make the upper arch wire 2 to 3 millimeters wider than the one that appears in this template. Very nice trick. It will save your time. There is no need anymore to take the wax pipe every visit. Okay, it's very time consuming. And then put this final arch form in the patient's file. Okay, so now we finished about the arch form. I hope I could have answered a lot of inquiries of that I received in the last few days. For the step down bends, when you want to extrude the tooth, it will extrude and it will change the torque. It's very important because you are applying a buccal force, and whenever you apply a buccal force away from the center of resistance of the tooth, you will have a moment, and that's why you will change the torque. We'll talk about the third order bend, which is the torque, later on. By the way, Charles Burstone mentioned that he only mentioned the name torque for the twisted wire. Otherwise, we usually use this torque name as a misnomer. Okay. Anyway, we'll come to this point. So I want to extrude this premolar to allow, you can see the palatal cusp impinging in my occlusion. I want to step this down to extrude, and then I can bond the bracket more gingival. And of course, take care about the adjacent, the reaction forces on the adjacent teeth. You can see, for example, this is the after extrusion. You can see that the molar is affected by the step down. You can see the torque of the premolar, second premolar, is corrected. However, the torque of the first molar have changed. So, and you have now a palatally, the palatal cusp is impinging on your occlusion. So that's why be careful on doing your bends. That's why many years ago I shifted towards bracket relocation or repositioning better, because the stainless steel wires gives a very heavy force to your teeth and the adjacent teeth. So that's why you have undesirable forces every time. Maybe sometimes I do it a lot. Just debond the bracket from this tooth and wait for the action of gravity to extrude the tooth. It's very, very nice trick. Why? Because there is no adjacent side effects to the adjacent teeth. Anyway, I'm giving you a lot of tricks, and this is how we do the step down bend. I want to save time to go for the other tricks, Maybe I can upload it on my YouTube channel afterwards, maybe next week. So don't worry about this. So for extruding the tooth, we can do a step down bend, and then most probably you have to go for a gingivoplasty so that you can bond the bracket more to the gingival. You can see how the lateral incisor is extremely short. So that's why I want to reposition the bracket more gingival. When you position the bracket more gingival, there is no enamel, so you have to cut the gingiva. That's why I use the gingivoplasty a lot. I do it with a scalpel with a number 15 micro, 15. If you have a laser, it's okay. I don't have a laser. And many periodontists, by the way, they don't use laser. So that's why I was not enthusiastic about buying the laser. Anyway, I cut the wire. Maybe I can bond it at the same visit if I control the bleeding, or maybe I can postpone to another visit. And hereby after relocation, and here is my technique in the gingivoplasty. It's very easy. I like to do the surgeries. The people who know me knows that I like to do all the orthodontic surgeries needed, the minor ones, of course. Surgical exposure, canine, gingivoplasties, and so on. I feel that I control my practice more. I know what I'm doing, and so on. And this is a very sharp cut, and I take it out in one piece. Very nice. When you have a sharp cut, my periodontist fellows taught me that you will have best healing for the tissues. When you're more into orthodontics, your eyes will go to the pinky tissues more than the white tissues, which are the enamel of the teeth. You will go for the gums, and you will check always the gum level and so on, how smooth, and you want to adjust the point, what we call it, the zenith, and so on. It's very nice. You will have perfect finishing at the end. And here is the patient before treatment, and this is before immediately after gingivoplasty, and this is the patient. I took the photo yesterday for you, so you can see the progress and the nice healing of the tissues, and you can see everything is adjusted. The smile arc is perfect. We're going to talk about the smile arc now. You can see how nice the braces is coming on from occlusal in the premolars, a little bit gingival in the canines, and two gingival in the laterals and incisors. I love these techniques. I learned it from Tom Pitt's articles. You can go and read about it. Another thing for the first order problems we always face is residual anterior open bites. And all of us will go and do the step down bends. And this is a skeletal 3 surgical, non-surgical patient. She refused surgery, actually. She was a female in the late 40s. She refused surgery, and I do a lot. And I have a very nice lecture about the buccal TADs, the infrazygomatic crest, and the buccal oblique shelf TADs. I have very nice experience in these two techniques. So I have placed 2 buccal TADs to retract, and then I want to increase the incisor show, so I told myself, okay, why not we do a step down bend distal to the lateral incisors to go them down. And then what happened is that the upper canine came up, and I lost the very nice interdigitation of the canine tooth because of the side effect. Although I did this bend on round 16 steel wires. What if you do this on rectangular stiff wires? And then I told myself, okay, I will not do this again, and I will prefer to do the rebonding. And I actually rebonded all the 6 front braces, and now you can see how smoothly the bite closed and the torque and the occlusion in the canine area is perfect now. And here's the patient. After the step down bend, you can see the interdigitation is not good, and there is after rebonding. That's why I recommend you guys to keep away from the step down bends, especially when you're using stainless steel wires, and go for bracket repositioning better. I love also my canines to have a little bit mesial out with the curve. I like this very much. So that's why I bond my lateral incisors and canines, maxillary and mandibular arches a little bit to the mesial to have a very nice curve mesial out, especially in the canines. And this is what's why I'm talking about the very good finishing. You can see how the canines are a little bit mesial out. I hate when they are mesial in. So it's very nice finish, very nice occlusion, very stable, by the way. So what happens in the step down bends when you do these step down bends? You always ruin your occlusion. So this is a referred case, and he did the step down bend in rectangular steel wires. What happened is that not only the canines lost the interdigitation, but the premolars also are going to tendency for an open bite. And also you can see transversely how the canines went outside or labially deflected. And I hate also this, there is no touching in the with the maxillary and the mandibular canines. I don't like to finish my cases like this. Why? Because when you do the step down bend, the torque of the canine becomes different, labially deflected, and then you will have what I call it a canine overjet. I really hate this. Even if you use stiff, heavy elastics, triangular elastics to avoid this, you cannot avoid it. Even if the patient is cooperative with the elastics. For the smile arc, this is one of my big issues nowadays in finishing, to confirm that the upper incisal edges of the upper incisors is conforming with the curvature of the lower lip, as stated by David Sarver and Roy Sabri. So my proposed bonding for this is that keep the lateral incisors the same height as the maxillary canines, and the central incisors is a little bit more than both of them. You can go 0.5 millimeter more apical, or only 0.25 according to your preference. You know that there is papers talking about it, that where is the proper position for bonding of the laterals. They should be, for example, the same height of the central incisor. I don't agree. I usually like to be 0.25 shorter, or 0.5 millimeter shorter. And yeah, I think you have to go back to your patient to talk about this, to discuss what's the preference of both of you. So, and hereby, how is the bonding is affecting the smile arc? You can see the deflection of the wire. It's very nice. So, and this is the patient a few months, maybe 8 months after treatment. Very nice smile arc. And also this patient, the bonding according to Tom Pitts, and here is the very nice smile arc. You can see it was very flat and curved. And this is what I do some teasing to my orthodontic doctors when they show us very nice veneers. I tell them, you want to see something natural, see this photo for this patient. And I was very happy, and the patient was happy. There is nothing prosthetic in this patient at all. I managed to create a very nice smile only by orthodontics and achieving her natural teeth. For the step in bends, I usually use them with the second molars, but actually you have to use the convertible tubes that, as I explained before, to control the torque and the inclination of the second molars. I have a full lecture about the American board grading system. Anyway, I will tell you a small tip of this. is that the fossae of the molars and the premolars should be on one line. That's why I did this inset in the second molar to correct the line occlusal, to align the occlusal fossa. How to detect that the molar is rotated? First of all, you can see that the mesiobuccal cusp, the tangent to the buccal cusp should be higher than the level of the tangent of the second premolar. But in this case, you can see it is on a lower level than the second premolar. Also, the large embrasure, the palatal embrasure, whenever you have a large palatal embrasure, you have a rotation in the first molars. Also, if you extend the line between the distobuccal cusp and the mesiopalatal cusp of the first molars, this line should follow the yellow line, which ends up at the canine cusp tip. However, now it is pointing otherwise. So I'm pretty sure now that my molar is rotated. And one of the things actually I recommend for beginners is to use the Gojgarian bar by Dr. Gojgarian, using lingual sheath and an 0.9mm wire. I have a very nice article published last year in the summer showing an efficient way for soldering the lingual sheath to bands if you don't have the welding or the welder in hands. First of all, I adaptation the lingual sheath on the bands using a Weingart and then hold them with a Matthew or a Mosquito, and then apply the flux, apply the solder, and now it's soldered. Quench it, of course, exactly after the soldering. Check the patent and there is no solder inside, because if you are enthusiastic and you place more solder, it will go and obliterate your lingual sheath. So if you do this, it's preferably you can go for welding your lingual sheath and not soldering them. Anyway, there are many things to do stuff in orthodontics. There are many ways to do it. Also, for the molar rotation, I always, of course, as I told you, I believe in the Gojgarian bar, especially for beginners, because you can actually remove them any time. If you need more, I do what I call it the step out and toy in. It's like the molar offset, but you have to toy inside again. Otherwise, it's a step out. You will dislodge your first molar completely outside the arch. In doing this, I recommend doing it with the rectangular TMA wires, and please remove the bracket of the second premolar before doing that. Otherwise, any action has a reaction, and you will spoil the occlusion and the position of the second premolar. Nothing will happen, by the way, if you bond your braces in the first time selectively and skipping and passing teeth. And also in the finishing stage, you can remove the brackets from single teeth, for example, like this situation, and then followed by full debonding at the end. I want to escape always from the undesirable side effects. You can also use brackets on the second premolars. However, it's a little bit tedious, and you have to heat treat your wire, especially for the nickel titanium, to bend this away. Anyway, I prefer tubes, of course, but most of us have failures. So you have to increase the retention. One tip is doing the sandblasting. You have to do this. You have to own this micro etch in your practice to help you. It's very, very important, especially if you're using indirect bonding a lot or using lingual orthodontics. So it is crucial to have this type. Like, of course, as I mentioned earlier, the force gauge. Also, you can use many tubes on the second molars. Also, a very nice tip. Immediately after bonding your tubes, apply flowable composite on the shelves of the tube. Like you can see in these two videos, exactly or immediately after bonding and before contamination of the area, apply the flowable composite and spread it and cure it. For the second molars correction, you have to use, I recommend using the convertible tubes. So as I mentioned earlier, you have to have convertible tubes. Because now, for doing an L loop to align the second molar, you have to convert your tube into a large bracket. And believe me, if you want to align your second molars with continuous wire, it will not happen. It will not happen. Don't waste your time. So you need some segmental or sectional or wire bending skills for this. It's very easy to do it chairside. It took me, I think, for this L loop, maybe 3-4 minutes. Okay. I will try to upload these videos on my YouTube channel too. Okay. This is called an L loop. And then go back to the plane of the wire. And then check that both ends of the loop are on the same plane from the occlusal view. Otherwise, you will have in and outs. Check the plane with your eyes. If you want to place it on the table, it's okay, but it's waste of time. As I explained earlier, just check with your eyes, close one eye, and then you can place it. See, this is how I check with my eyes. One plane. See, this is one plane. There is no need to go to the table. Okay. And then insert it inside the patient's mouth. It's very easy now because I'm inserting directly inside the second molar tube. And then I'm just dealing with the tube on the first molar as a large bracket. And of course, never ever put an O-tie on a convertible tube. Otherwise, you will have much problems. You have to use the steel ligatures as I've showed you before. Don't trust O-ties or elastomeric ties in both the space closure and the finishing stage. Checking the plane, everything, and now the problem is, in this case, the margin ridge of the second molar is a little bit below the distal margin ridge of the first molar by 2 millimeters. So it's very easy for me to control this marginal discrepancy. And one of the ABO grading system rules is that the marginal ridges of the posterior teeth should be aligned. Otherwise, you will have a minus or negative when grading your case. It's very easy also to avoid impinging of the loop towards the cheek and towards the gums, especially for the round wires. If you hold them just mesial to the loop and then just move the loop to the inside, you can correct the plane, and now it is not impinging neither on the gums nor on the cheeks. It's very easy. And now you can see it is activated to align the second molar. It's very nice. Overlay wires, I use them a lot also, not only for the impacted canines. Why not? Why not for the second and the third molars? For example, this case is I'm aligning a third molar after closing a very old extraction space. And this is the second molar, by the way. And I use that screw and an auxiliary wire for protraction, and then using the overlay wire for alignment of the third molar. Another patient also, there is discrepancy in the marginal ridge. In the last slide, I played it with the convertible tube and an L loop. Now I don't have a convertible tube. I have just double tube. It's not convertible. So I use the overlay wire. utilizing the, you can see here, putting the main arch wire as a stainless steel for consolidation and the overlay 14 nickel titanium wire, and then I ligate them, all of them together, not separately, so that the overlay wire is engaged in only in the tube of the second molar to correct the inclination. Alternative, it came to my idea one day that one of my patients is keeping debonding his second molar tubes. So I told myself, why not to bond the wire? It's a very nice trick. And here is the patient before alignment of the second molar and after alignment. And then, of course, I will not finish like this. I have to bond the tubes now, but it's very, very easy. And it will be more reliable and with less bracket failure or tube failure at that. I said, etch the area, clean and dry, apply the bond, hold the wire, apply flowable composite, bond all this, bond all of the wire and the tooth with a flowable composite and cure it. That's all. Nickel titanium and heavy elastics, you can also use that by repositioning the tube more apical. And of course, there is severe deflection of the wire. So I don't leave it like this. I have to apply heavy elastics to avoid, as you've seen earlier, the side effects of the buccal rolling of the first molars. And here is the after alignment. You can always use indirect anchorage. This is the patient before treatment, extraction, TADs for retraction, and so on. When you're done, you can always use the screw again to align other teeth indirectly. So I bent a small wire inside the auxiliary tube, and then the main wire went continuously to the second molar to align it. And now it is perfectly, we have perfect interdigitation and torque. It also torqued the second molars. That's my take-home message for you today, is that these procedures, what I'm showing to you, is not only aligning the second molars, they are also correcting the torque of the second molars, which is really problematic. So that's why I don't bond my tubes, my second molar tubes near to the occlusal. I mostly bond them near to the gingival part to play with the torque or adjust the torque early in treatment. And this is the patient before and after treatment. Everything is aligned, everything is perfect. Rectangular loop also can be used sectional to align the second molar. It's very easy. I will try also to upload the video of manufacturing this loop. It's made of 17 by 25 TMA wire. It's very nice and easy. Please don't try to do these with stainless steel. Please, you will hate yourself. The TMA wires are 3 times more flexible than the stainless steel. So you won't have bracket failures with them. You can easily bend them. You can easily insert them in place. You will like them so much. The only disadvantage is that they are expensive. Here's another also way of doing that, an extruded, extremely extruded second molar. I did the L loop. You can see how they are extruded and impinging on the lower gums, and can easily corrected here by intrusion and tipping. You know, this segmental wire is doing a lot of movements or a lot of 3-order or correcting a lot of 3-order problems in one go. It's very nice. Okay. I love TMA wires, of course, and I use them during space closure, and I have, of course, another presentation for the space closure. So also cantilevers, not only uprighting them, I can push them inside the arch lingually by the cantilever using Mulligan technique, Burstonian mechanics, to push them inside. If you have third molars in play in occlusion, this patient was referred to me after extracting her first premolars. So that's why the 8s are in action. So you must not leave them at all. They must be aligned. This is the 6, 7, and 8. So you have to bond the third molars also to have very nice finish at the end. All of us needs cross elastics at the end of treatment to correct and refine the occlusion. You will need a lot of buttons and so on. So my tip for you is dividing the bracket into 2 halves using the heavy cutter, and I will also upload the video for you on my YouTube channel. Just squeezing the bracket into 2 pieces using the heavy cutter. Bondable aesthetic buttons, I use them a lot. If you're using Invisalign lingual braces, also the labial ones, you may get out of stock of buttons anytime, and it's very nice to learn how to put these buttons. And I also will upload them on my YouTube channel, don't worry. Using flowable composite with an elastomeric tie, and you do the mushroom shape by your own. It's very nice. It's no template. It's like applying the flowable composite and coming out. You will have this mushroom because it will rest on the elastomeric tie itself. That's why it takes the mushroom shape. Okay. I will skip this arch form. We talked about it earlier. Okay. We'll go for the, just a minute. We'll go for the, because we're out of time, I want to talk about the third order bends. Okay. So for the third order bends, I hope you can see my screen. It's stated the third order bend or the third order problem. You have to analyze the torque of your patients, and this is a typical class 2 division 2, and I have a separate lecture talking about this, how to analyze the cone beam CTs and select the proper bracket positioning and so on, and how you can see here there is no bone at all for the class 2 division 2 incisors. That's why you have to take care to develop the torque, and this is the patient after developing her torque. So talking about torque, you cannot produce torque using ground wires, of course. Also, many clinicians should realize that the thin stainless steel, the thin rectangular wires, they will not produce torque as well, because there is a what we call it torque play. So my take-home message in the first place, please do not lose your torque in the beginning, because losing your torque, this is a referred case to me. He's using, I don't know, reverse curves and severe or heavy power chains. I don't like, by the way, the continuous chains, and I don't encourage beginners to use the chains. You will always go wrong with these continuous chains, very heavy forces. And this is the patient, unfortunately, with incisor torque loss. Even if you're using T-loops, you will also, if you apply heavy force, you will lose your torque too. Also, round wires, if you're using round wires, you will also lose your torque, but if you are fond of that, so don't use, please, less than 0.020 round steel wires. Okay, otherwise you will have lose a torque. I like the loops a lot. There are different types of loops. I use the teardrop loops and keyhole loops when there is minimal spaces. And of course, you confirm them on the template. And the problem is that we must understand that we have much torque play in our wires. So if you are using 16 by 22 steel wires in 22 slot, that means you will have nearly 21 degrees play. But using a 19 by 25 steel wires, you still have a play, by the way, and you're not safe in preserving your torque. So that's why you have to take care. Theoretically speaking, the 21 by 25 has the least play, of course. However, you cannot use them in sliding mechanics. The teeth will not slide. So that's why we don't use them in sliding mechanics. Actually, I don't have a 21 by 25 steel wires in my stock. If you want to express the full built-in torque in the brackets, you should go for the TMA braided stainless steel or braided copper tie wires. Don't go otherwise. And they are, of course, available in different companies. The new braided copper tie Nanda ones, and so on. And that's why the 18 slot users, they are always proud that they have minimal torque loss in their cases. Why? Because they have less torque play, even if using less rectangular arch wire dimensions. If you are having much space, I recommend using the T-loop or the mushroom loop. Actually, I don't buy them ready-made. I do them, I customize them, or I bend them, preferably in TMA wires, and then do my alpha and beta bends to control the torque, the alpha and beta moments. And you can see now when it is engaged inside the brackets, they are far much better. Don't place the loops distal to the canines if you want to control the incisor torque, because it will be more affecting the canine tooth, and you will lose the tip of the canine tooth in doing that. Of course, you can always twist the wire using the torquing keys. Okay, and then place them inside the bracket. Make sure that they are fully seated inside. Of course, in most of our cases, we have problem in the third order bends in the maxillary lateral incisors. So you can use the key pliers, or I prefer actually the two ribbon arch pliers better. Why? Because the key loops, the key pliers give a twist in a very narrow segment of the wire. But when you do it on the ribbon arch pliers, you can expand the area and take the most of the interbracket distance. Okay, don't forget to bring the rest of the wire to 0. And also, you can actually find this video on my YouTube. It is uploaded, I think, 2 weeks before. You have to make sure that on placing the wire, that the torque is expressed inside by twisting, using your finger to twist the wire inside the slot and secure it inside. Otherwise, it will be outside the slot. And this is one of my patients with an impacted canine. I do the surgical exposure, delay the bonding, retraction from under the gums until it reached to the distance, and then with vertical pull, and then doing the re-surgical exposure again to align it inside the arch. And then, of course, it took me tremendous work to correct the torque of the mandibular canine. Okay, rebonding, twisting, and so on. Until you are satisfied with the finishing of your cases, you can see here the twist. Well, this is what I'm talking about. If you're using the key pliers, it will be on a short distance on the wire, but if you're using the two tweed ribbon arch pliers, you can utilize much of the segment, and whenever you're going with the TMA wires, you will lighten your force, and whenever you are increasing the wire twist, you will also reduce the force. It's very nice torquing the teeth with light forces. And here's the patient checking the occlusion. I do it in every patient, checking the occlusion. And here's the patient, everything aligned. Yeah, I usually, as I mentioned earlier, I bond the canines a little bit to the mesial, both the laterals and the canines. A little bit to the mesial, and yeah, there's the patient after treatment. You can see how the torque of the canine tooth, it's unbelievably magic, but it takes much work and hard effort. This is the finishing stage. You have to put much effort in your finishing stage. Also checking the functional occlusion. The patient is happy with her smile. I'm happy. Everyone is happy. I will end up my presentation with these torquing springs. It's very beneficial. I use them a lot nowadays in my practice. We're using a base arch wire 17 by 25 steel, and you can always use the ready-made ones, or actually I do them also because I always got them out of stock, so I usually do them by my own. Unfortunately, I use the intrusive arches at the beginning of treatment to correct the torque, but it is actually never enough. So you have to be prepared with your torquing springs. And here's the patient with the, I want to torque the lateral incisors. Whenever the springs are pushing from the incisal part, you are calling for labial root torque. When the spring is pushing from the gingival part, you are calling for palatal root torque. The springs is engaged and threaded inside the arch wire so that they are on one plane with the wire. And then you have to crimp them to the wire. Okay. Crimp them with the wire, with the coils should be crimped to secure them on the arch wire, and then they are ready for insertion. If you're using self-ligating brackets like these ones, it's okay. If not, I recommend really to steel ligate your brackets. And whenever you are adjusting the torque of the incisors, please don't forget to cinch back your pliers. And this is the patient 1 month. And actually what happened is during the quarantine, the patient didn't show up until yesterday. You can see how excessive the torque is applied. That's why my take-home message is, if you want to correct the torque, give it some time. Don't be in a hurry. So now we have excessive correction of the torque. Too much, as you can see, the roots are impinging from the labial cortical bone. That's one of the problems maybe of the shutdown and the quarantine the last few months. But anyway, it's very nice to know that you can control your torque whatever you want by any amount you want. My last slides is this one with a deflected or displaced lateral incisor. I don't extract, of course, in class 2 division cases. I struggle to open space, and then you will have a fight with correcting the torque. And of course, I recommend using the torquing springs. And I always take a question is when do you bend or twist the wires, and when do you use the torquing springs? And here is the answer. Whenever the the interbracket distance is small like the lower incisors, it's better off for you to use springs. Why? Because it will deliver a little less forces than the twisted wires. And I want to end up my my presentation by thanking you all for attending my lecture. I know it's a little bit long, and thank you, Dr. Kim, Dr. Park, Dr. Chung, for inviting me to your amazing platform. Thank you so much.